So I said there's three things that we want to talk about today that your doctors may not have told you about pre-diabetes. And the first one is that pre-diabetes is a dangerous, serious health condition. I know sometimes we can hear things about, well, pre this or pre that, and it seems like, well, that's not that big of a deal. I don't need to really worry about this, but that is not the case with pre-diabetes because first of all, pre-diabetes indicates those people are much more likely to become diabetic. It makes sense, but the number is pretty striking. About 70% of people with pre-diabetes eventually find out that they are eventually advanced to having diabetes, and heart disease risk, stroke risk, and many cancers are dramatically higher in people with diabetes. And in fact, a lot of times doctors talk about diabetes as a vascular disease, meaning that the reason people with diabetes die or have serious health complications is less often diabetes itself. It's actually the heart disease that is created or driven by that diabetes. It leads to buildup of artery disease called atherosclerosis. And so people with diabetes have a very high likelihood of developing atherosclerosis or artery disease, which is the number one cause of heart attacks, the number one cause of stroke, the number one cause of lower leg amputations, like needing to have body parts cut off. It's because there's a buildup of artery disease in the wall that prevents blood flow from getting to that tissue. So, that was one of the landmark studies that was done in the 1980s, where they looked at people that have had heart disease before, meaning they've had heart attacks, they've had stents, they've had bypass surgery. And then they looked at people with diabetes that have not had heart disease yet, and found out both groups had the same risk of future heart attacks and artery disease. So that led to the kind of complete change about our approach to people with diabetes is, look, we can't just wait for the artery disease to develop. It's so high of a risk. We need to be aggressive. And what the concept in medicine is called treat to secondary prevention, meaning that we treat people with diabetes just as aggressively to prevent artery disease as we would somebody who's already has artery disease, because we know their prognosis is poor if we don't take a very aggressive approach to that. For people with diabetes, their probably most important doctor outside of their doctor that's managing their diabetes is going to be their cardiologist, to try to do everything we can to lower their risk of future heart problems. From a heart standpoint, I think prediabetes can fly under the radar. Like, people don't understand that okay, well, with diabetes, I know I'm at high risk for heart disease, but the reality is people with prediabetes also have about twice the risk of future heart disease as those people who don't have pre-diabetes. And oftentimes their cholesterol numbers don't trigger the same concern as from their doctors as those with heart disease. So what we'll see is that if somebody has an LDL cholesterol, that's commonly referred to as the bad cholesterol, that's really high, doctors are on that. Like, they know, okay, that's not good. We really need to get that LDL cholesterol lower to lower your risk of future heart attacks, strokes, and death. But what happens with prediabetes is that the cholesterol number, the LDL cholesterol, may not be the problem. It may not be strikingly high. In fact, it might even be in the normal range, but it's the other parts of the cholesterol profile. The triglycerides are high, the HDL, what's called the good cholesterol, is low, and it's under recognized that that's a really bad combination. Like, that indicates your metabolism isn't healthy, and those are the people that need to be treated very aggressively to prevent heart disease, because they're at very high risk for future heart disease. So I think that gets missed a lot of times. And To put this all together, like unhealthy cholesterol, the high blood sugar levels, the high blood pressure, the unhealthy weight, those all four go together very commonly. They're called metabolic syndrome or metabolic disease, what I call unhealthy metabolism. That's our goal, is to get the metabolism as healthy as possible, because we know the unhealthy metabolism is the big driver for heart disease, for cancer, for stroke, for dementia. If we want to we want people to live a long, vital, healthy life, we got to get their metabolism healthy. And part of that is the blood sugar and the prediabetes. So my guess, for people that say, what, I have a high blood sugar level, it's not going to be a surprise if they also, find out, what, my blood pressure is not as good as I'd like for it to be either. My weight's not where I want it, or at least I'm carrying it in the wrong place. I'm carrying it around my middle, or their cholesterol numbers are unhealthy as well. Those go together very commonly. And I personally think that is the biggest problem in healthcare and is often under-recognized. Here's the point, though, also of that sounds really doom and gloom, like, oh my gosh, prediabetes, very serious condition. But here's the real point of knowing that you have prediabetes. It is not only preventable from going on to becoming diabetic with high likelihood of success, it's actually high potential with the right strategy to reverse or even cure the prediabetes. How do we make our metabolism healthy? Like, what are the ways to do that? One is medications. We can use medications like metformin, but they're not as good as what really works. And we talk often about the 6 tools that are most effective in healing metabolism. And that includes lowering the risk of prediabetes, lowering the risk of diabetes, lowering the risk of heart disease and cancer and dementia and all those things. What are those 6 tools? Nutrition, physical activity, sleep, stress, avoid toxins, staying connected. How many people have gone to the doctor and been told they have prediabetes, or unhealthy cholesterol, or unhealthy weight, or high blood pressure, and were told by their doctor, these 6 tools are foundational, are the place we need to start to get your numbers where we want it to be and get your health where we want it to be? And how many people have been just offered a medication? I want to wrap up with this, because this is maybe the most important thing I learned in my medical training, the thing that changed my life, and how important this is for you if you have prediabetes or you have an unhealthy metabolism. And it's this information that you really need to know. So if you heal your metabolism, if you get your blood sugars normal, you get your blood pressure good, you get your cholesterol good, you get your weight good, and you do that using the 6 tools, the nutrition, physical activity, sleep, stress, avoid toxins, staying connected, those people that do those things have 80% less heart attacks. They have 80% less fatty liver, 80% less heart failure, about half the less strokes, about 60% less kidney failure, 60% less atrial fibrillation, about 40% less dementia, and about a third less cancer. And they add 12 years to life on average if they're men, and 14 years of healthy life if they're women. Like, how amazing is that? How crazy is that? I mean, I've been talking about this for 12 years and it still blows me away. One, how important it is to have a healthy metabolism. And number 2, why everybody doesn't know this. Because it's our lives. This is our health, our lives. And so many people don't understand the opportunity, the power, the control that they have over this. Where are you right now? What do you need to do to achieve your health and longevity goals? Like, not my goals for you, not Ryland's goals for you, but what are your goals? Here's what to do. And then how do we set up a system, a process, a program that shows you how to do it. That's what we do. That's my passion. That's what I spend, the majority of the last 12 years figuring out how we can do that, get people clear on those HealthspanMD 10 essentials for longevity, for great health, and give them a clear path in a program that supports them to get that done. So if that's something that you're interested in, then what we would recommend is schedule a strategy consultation with us. Really just a conversation that we're going to find out what your goals are, what you want to accomplish, and then if we can help you do that, then we're going to offer some solutions to you. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.